Absolutely. We think that they are both useful and reliable. There are some symptoms that it makes no sense to ask patients to report directly. We don't want patients to self-report their white count or their platelet count, but there are some symptoms that we absolutely think are best reported from the patient perspective. Pain, nausea, fatigue, trouble eating. These symptoms are really experienced by patients, and their viewpoints and their reports give clinicians the best opportunity to understand and to intervene. So when we started this line of research, we had many questions about whose reports were accurate and whose reports were right. And we did lots of research, and we came to understand the reporting patterns. When we ask oncologists to report symptoms, they tend to take these scales, the CTCAE scale in particular, and they collapse into symptoms that are severe enough so that I cannot give the chemotherapy or the planned treatment, or no symptoms. So they take the scale and they collapse it, and it becomes binary. This makes sense because the oncologist's decision that he or she is confronting is, today, do I give this patient the planned treatment or do I not give this patient the planned treatment? And that's what the reports look like. When we ask patients, there's more nuance and more detail. Patients use the full scale. We think it's very helpful to see patients' trajectories over time. It helps the patients and it helps the clinicians. We've done a series of experiments that show that clinicians believe our patients. When you expose clinicians, whether doctors or nurses, to the patient's reports of their symptoms, they accept them. In fact, clinicians will change their own scores to match those that their patients report. So we do think this is valid information and helpful, useful. Absolutely. So I think the most important thing that we've learned and we found is that this information is valuable and helps us provide better care. So having patients report kept people in our randomized trial, kept people out of the hospital, kept people out of the emergency room, and to our surprise, helped people live longer. But we also see at smaller scale that this affects day-to-day decisions about symptom management, whether to continue chemotherapy, as well as whether to prescribe drugs to manage pain, to intensify nausea management, for example. So we think very simple, inexpensive, relatively quick and easy to implement. Just asking patients in a systematic way improves the value of the cancer care that we deliver, and we have urgent need to improve the value of our care because as it is, it leaves a lot to be desired. We've deployed this tool in many different populations, mostly adult populations, although I have a colleague who's also done this with pediatric oncology patients with very good success. So we find that when we ask patients to report repeatedly at multiple visits, about 3/4 of patients will do so regularly. They'll reliably report their symptoms on an ongoing basis. When we call and remind or prompt patients, we can get that up to about another 15%. So we can get almost to 90%. And then there's a ceiling effect of about 10% of people who we just are not able to engage in this manner for a variety of reasons: frailty, uncomfortable with the technology, discomfort with technology. But again, 75% quite easily is rather favorable.